Hello, welcome, everyone. Welcome to another Sunday afternoon with Askawayhealth Live. I'm your hostess. My name is Dr. Sylvia. I'm a general practitioner and health educator with Askawayhealth. If this is the first time you're coming across my channel, I'm so pleased to have you here, and to old viewers and subscribers, you guys know how much I love you and appreciate you. Thank you so much for spending your Sunday afternoon with me for a short period of time. On this channel, we have videos discussing trending medical, wellness, health, and lifestyle topics to educate us and help us get the most from life. We tend to publish a video every week and share this live stream on Sunday afternoons, just 15-20 minute chats on common health issues. I hope you can make it a date with us whenever you can. You can find us on social media on Askawayhealth. So have a look on Twitter, LinkedIn, Facebook, Instagram, and of course our website is askawayhealth.org, and of course our YouTube channel here. You'll find the links in the description box. So make sure you find a way to connect, like, and subscribe with us if you haven't already. So today, what are we looking at? Actually, before that, let's have a quick look on the chat, see if there's anyone lurking. Hi, David. Thank you so much for joining this afternoon. Hope you're keeping well. Hope everyone's doing well. Hope the family's good. Hope you're having a good Sunday wherever you are. So today we're continuing our look at pregnancy stories. Can you believe we're in week 5? We started this series a month plus ago to look at whether or not we're glossing over the sometimes serious complications that women could develop in pregnancy and childbirth. After a very interesting thread went viral on Twitter, and lots of women talked about experiences they had in pregnancy and after delivering their babies. And one of the most common thoughts was that, oh, I wish I had been told, I wish I'd known, that would have helped me deal with it better. So I thought, okay, let's provide a forum to provide this information. So if they're new moms or expecting moms, you have the access to some of these health conditions. So here we are with 5. We've already talked about breast issues during pregnancy and afterwards. We've looked at abnormal vaginal discharges. We've talked about having cuts or tears to your perineum, or episiotomy is the other term for it. We've talked about abnormal bleeding after birth. So we've looked at quite a lot of these topics, and if you're interested in them and you want to learn more about these, please make sure to check out the description box. I will put the link to the playlist where you can sit and get all the information that we shared. But today, this week, we're looking at urinary incontinence during pregnancy and beyond, which I understand is, of course, a topic that will also generate quite a lot of interest for many women. I'll just put up the slide that we have here. Yes, so we're talking about urinary incontinence, what it means, pregnancy and childbirth, usually a joyful time, and then this problem develops and you're wondering what's going on with my system, why is this happening to me? So let's have a look, let's have a little look at this aspect of pregnancy today. I'm using the new streaming software. I'm trying another one out today, as you can probably tell. Let me know how this looks. Let me know if you like the feel, if my volume's good, if the camera's good, if how the screen looks. I appreciate the feedback, so I make sure I'm giving you guys the best. So very briefly, we're going to look at what is urinary incontinence in pregnancy, why, and actually better said, how does it become a problem? How does it develop? What are the kind of urinary changes that you might expect when you become pregnant and after childbirth? And then we'll look at the risks of developing urinary incontinence. So who is more likely to get it, or what condition does a woman have to be in to get urinary incontinence? And then finish up with the treatments and look at a few tips to prevent the development of urinary incontinence. So to start, what is urinary incontinence in pregnancy? Very simply, we're talking about a loss of control of your bladder. Incontinence just simply means that there's a loss of control over the function of an organ, but urinary incontinence is referring specifically to the bladder, and it is by far the commonest type of incontinence that you can encounter in pregnancy. If you look at, or if you joined in our perineal cuts and tears live stream, we talked about anal incontinence. That's another problem altogether. So have a look at that if you want to learn, and that's where there's loss of control of the bowels of the anus. So the soiling, fecal matter and stool, you can't control that. That's different. We're talking about the bladder and urine. So when you're pregnant or after delivery, and it could be one of different features, you might feel an urgent need. You've got to go and urinate, or when you're on your way to the toilet, you might leak. So you're trying to get there, and before, when you could sort of control yourself until you get and sit on the toilet, but this time you leak urine before you get to the toilet, or you find that you're having to go several times. You've been, and after 20 minutes you're off again, after another 20 minutes you're off again. Any of these are what we're just talking about when we say we're looking at urinary incontinence in pregnancy. But the thing is, they can also happen outside of pregnancy or childbirth. They can happen as we go older, or in certain other conditions that I will talk about in a little bit on the stream. But I wanted us to get a bit of background. We're talking about urinary incontinence. Let's have a look at the bladder. I've got a lovely image here that I'd like to share with you so that you can understand what I'm talking about. So bear with me while I get that up, share my screen, and you will see what I mean. Yep, so we've got this picture, which hopefully you should be able to see. And it's a picture that shows the woman's organs, internal organs from the side, so the side view. And what you can see, mainly 3 organs here. The bladder is right in front, behind your pubic bone. So that's the pubic bone here, and immediately behind sits the bladder. So like an upside down balloon, and behind the bladder comes the womb. Okay, and so it's in the middle, because behind the womb comes the rectum or an anus. So these are the 3 main organs. There are lots of other different things going on, of course, within that area, but these are the key organs. So I want you to have a look at the bladder. And the bladder, the base of the bladder is at the top, and you have this little tube that's called the urethra. This is where your urine comes out of the bladder and passes out when you urinate. So it's the urethra, is the tube, and that's the urethral opening right at the bottom, which comes out at your pelvic floor. Now that we've had a look at it. What's important is that the control of your bladder is usually subject to a few things. Normally, it's a little muscle called the sphincter around that urethra that keeps it closed. And the control of that muscle is subject to your brain, your ability to decide when you want to go and use the toilet, how full or not your bladder is. So of course, when your bladder is very full and stretching, your body sends messages picked up by nerves that supply the bladder to your brain, and that message stimulates you, telling you, oh, your bladder is full, you need to go and wee. So all these things normally are under control, but we're talking about when that control goes. So in pregnancy, what commonly happens is that you start losing bladder control, primarily because your baby grows bigger and places pressure on your bladder. I've got another lovely picture here that I wanted to share with you. So let's just put that up so that you can understand what I mean by how in pregnancy you might experience that pressure. So hopefully what you're looking at now is the picture I have with the little baby, with the baby in the womb. And if you look down, let me just pull this. Yeah, so hopefully if you can see what I'm trying to present here. So you can see the bladder again, that figure here. And of course the womb is stretched up all the way, it's gone up, and then the rectum and the anus behind. But you can see that the womb has taken virtual control of everywhere. So it's putting pressure. And so putting pressure on the bladder is one of the most common reasons why you might experience frequent trips to the toilet. So this is the key change that you would experience when you're pregnant. As your womb gets bigger, as baby grows, you would experience frequent trips to the toilet, and you might also experience episodes of leaking when you're trying to get to the toilet, simply because there's pressure on your bladder. The bladder is flattened, there's less space for urine, so your bladder can't really expand as much as it used to. Very little volume, you're off to the toilet. So it makes you have that urge to go to pass urine more often. But it's temporary and it goes away weeks, within weeks, days and weeks of having your baby. Now, when we're talking about loss of control, that's different from this method I've just explained, which is natural as the baby grows bigger and puts pressure. There are other things that can cause you to experience that loss of control. The first one is what we call a prolapse of your pelvic organs. Remember, I showed you the picture of your pelvic organs. If the muscles around your bladder become weak, the bladder itself can actually slip out of position, or it sags or droops, which allows that urethra that I told you is normally held closed by a muscle, a sphincter, causes it to open. So this is one reason why you might have loss of control, because of a pelvic organ prolapse. In this case, your bladder prolapses. Prolapses means that it moves out of its normal position. There could also be damage to the nerves. I told you, just now that your nerves are important in terms of giving you control over how your bladder opens and closes, in addition to other factors like how stretched the bladder is, how full it is. But damage to the pelvic nerves that control the bladder, which could happen, for instance, if you're having very long labor, or the vaginal delivery is difficult and they might have to use your doctors or midwife, they might have to use instruments to assist. That may contribute to, that might be another reason why your bladder, why you may lose control of your bladder. Another reason is if there's some kind of injury during delivery, and particularly or commonly with delivery with forceps, can lead to damage to the pelvic floor muscles. And pelvic floor muscles, as you'll see in the next few minutes, are really important in this discussion. So instrumental delivery using forceps can cause damage to the pelvic floor muscles, the muscles of the sphincter, of the anus, and that can sometimes contribute towards loss of bladder control. Things, fairly simple things, like when I say simple, I mean sort of straightforward trauma, pushing, prolonged pushing. So if you've been in labor for a prolonged period of time, and you've been pushing, your tissues are injured, your tissues are so inflamed, that prolonged pushing effort during vaginal delivery can also increase the likelihood of injury to your nerves. So these are some of the reasons why a woman might sustain loss of bladder control that's different to the pressure, the natural event where your baby is growing bigger, so your womb puts pressure on all the other organs. So these are some of the other reasons why it could happen. The most common, the different types of urinary incontinence, but the one that tends to be most common when it happens is stress incontinence. It's so called because you experience stress and the incontinence happens. It's the type of incontinence, and that is leaking from the bladder, that you may experience if you have a deep cough, or if you cough, or while you're talking, or you're enjoying a joke and you give out a deep laugh, or you're doing some physical exertion, for example, jumping. So after you've had your baby, for example, and you're trying to get back into shape weeks and months after, and you're running or jumping and you leak. Now, that type of incontinence is known as stress incontinence. It's one of the most common that you would observe during pregnancy. And it's important to note, because what contributes towards it are some of these things we've talked about: the pressure within the abdomen, the contributing, the weakness of the pelvic floor also contributes to that. So it's just good to bear in mind that that could happen. Now let's look at the risks of developing urinary incontinence, and by that I mean who is more likely to have urinary incontinence or struggle with it after their pregnancy. Now, Urinary incontinence after pregnancy usually depends on a number of things. We've talked about the direct causes, but in some cases, it's more likely to happen. And the type of pregnancy that you experience. So, for example, you're delivering vaginally and for some reason you're in prolonged labor. We've explained how that can contribute to injury to the pelvic nerves and contribute to loss of bladder tone. The type of delivery that you have. So we're talking about a vaginal delivery compared to a cesarean section. You're more likely to experience a urinary incontinence if you have a vaginal delivery compared to cesarean section, because obviously in a CS, where nobody's coming close to the vagina or the pelvic floor, your delivery is being carried out via the abdomen. But in addition, with the vaginal delivery, you could have instrumentation, and we've just finished saying that some types of instrumentation, like when they use the forceps instrument, could lead to some damage to your pelvic floor muscles. Another factor is the number of children that you have. So we know that women who have had more children are likely to experience prolapses of the bladder and other organs because they have weaker pelvic floor. So especially if they've had all their children delivered vaginally, they're likely to have a weaker pelvic floor, which contributes to developing prolapses and loss of bladder control. Now, the studies also show that women who've given birth, whether it's by vaginal birth or cesarean section, are actually at a much higher risk of stress incontinence than women who've not had a baby. And another important risk factor condition where a woman is likely to develop urinary incontinence is if you're overweight. So these are some of the important features about urinary incontinence and who's likely to develop it. Now let's look at when should you be worried about urinary changes. So when you're pregnant, you can expect that you'll be going to the toilet frequently. Your hormones will help, will contribute to that. But primarily, as you enter your second trimester and your womb starts growing outside of your pelvis, right into your abdomen, putting pressure on everything else, you go more frequently to the toilet. You may have leaks as a result of stress incontinence. Now, these symptoms are generally temporary. That is, after you've had your baby, and within a few weeks of having your baby, they should naturally settle down. So if you're still having problems for, say, 6 weeks or more, once it's over 6 weeks and you're still having problems, that's the time to start talking to your midwife or start talking to your doctor to get advice about what's going on, particularly if you have also had instrumentation. So please, many women tend to just think, well, it's something that they've developed. They might just keep it to themselves. It is embarrassing, it is uncomfortable, and it can also affect the quality of life. But many women, because it's embarrassing to talk about it, sort of keep it to themselves. Things can be done about it. So please, if you do start to experience those symptoms as early as 6 weeks after you've had your baby, have a chat with your doctor or your midwife. Please don't be embarrassed. Now, let's talk about how bladder control problems can be treated. And there are several different techniques. Of course, it depends on the cause, as usual, depends on the severity, but there are a few things that can be done to help control and treat the problem. Pelvic floor exercises that you might have heard of. I talked about this quite extensively in our video on perineal tears and cuts episiotomy, so please have a look at it. But pelvic floor exercises that you can do before you get pregnant, while you're pregnant, and afterwards can help to reduce urine leaks. Also, you have a look at changing your diet and losing weight. Remember I've said that being overweight can increase the risk of developing urinary incontinence. So looking at changing your diet and losing weight, if that's appropriate for you, please do that to help control, especially if the symptoms are mild to moderate. That could just simply be the way to control it. Some women find that when they switch to decaffeinated drinks or just plain water, helps to control their urine leakage, because the caffeine, taking beverages like caffeine or tea or carbonated drinks can stimulate the bladder, make you feel like going to pass urine a lot more often. Of course, things like limiting or controlling the amount of fluids that you take before bedtime, might help to reduce the number of times you get up at night to go and pass urine. Another important tip is eating foods that are high in fiber to avoid getting constipated. And if you remember, if you go back to that image I showed you for the pelvic organs when you're looking at it in the side view, the rectum and anus are right behind the womb. If you're very constipated and that the rectum and anus are filled with hard feces, that can put pressure on the womb, put pressure on the bladder, and can affect your bladder control as well. So please bear that in mind. So foods that are high in fiber, make sure that you're taking lots of water to drink in a controlled fashion, obviously, but during the daytime when you're sort of able to use the toilet, drink plenty of water to help to keep your hydration up and reduce the likelihood of getting getting constipated. We've talked about maintaining a healthy body weight. Excess or extra body weight can put pressure on the bladder. So if you imagine an individual, a woman who's overweight with a lot of fat, particularly around the abdomen, that can put additional pressure on the bladder, similar to the way when you're pregnant, putting pressure on the bladder. The excess fat around the abdomen can also contribute to loss of bladder control. So losing weight after you've had baby can also help to relieve some of that pressure on your bladder. There are things like continence pads and pants, underwear that can help to manage bladder control, bladder leaking episodes and accidents, to minimize the discomfort and the embarrassment that some women can get with this condition. That obviously does not replace actual treatment, but it's just a way to cope with the problem as you're working towards treatment. For some cases that are most severe, then surgery. For example, if somebody has a bladder prolapse, which is called a cystocele, but it's a bladder prolapse, we grade this in different degrees depending on how severe it is. If somebody has a very severe degree, it might be that they need some form of surgery to lift the bladder up and reposition it properly within the pelvic within the pelvic floor. Right, now let's look at how loss of bladder control can be prevented. I'm just going to, should we just have a quick look at the chat, see what's going on here? Oh, here we have a question from David. What should women do to prevent urinary incontinence? Very well timed. Very well timed, because we're going to talk about that next. So how can women prevent, how can they prevent developing loss of bladder control? So we've looked at different factors that can cause this. We looked at the type of labor, vaginal delivery. We've talked about injury to the tissues, damage to nerves. These are some of the factors. So deciding the type of labor and vaginal delivery, if it's within your power to do so, to make the choice about whether to have a vaginal delivery or cesarean section, then that might be an option. Yes, we know that cesarean sections have a lower risk of incontinence, but they do have other risks. So it's about managing or weighing the balance. There's some things that you may not be able to do much about. For example, if you have a very large baby, which could happen in some cases, we know that babies who weigh more than 9 pounds or more than 4 kilograms can increase the risk of nerve damage to the nerves during delivery. But so looking at the type of labor or vaginal delivery is something that you can discuss. You can discuss that option with your healthcare provider to see, is there any way you could have one method preferred to, or one option of delivery preferred to another. It's worth having the discussion. What things that you can actually do that could help are pelvic floor exercises, really helpful. Like I said, even before you get pregnant or while you're pregnant, can help to prevent bladder control problems. Keeping a healthy weight before you get pregnant, during your pregnancy and afterwards. Don't forget that bladder control problems can show up months to years after childbirth. So that's why I call this stream urinary incontinence during pregnancy and beyond, because remember we said that women who have had many children, particularly if they've been delivered vaginally, may be the ones that develop urinary incontinence. And I have had a number of people I've treated who develop a prolapse in their 60s or 50s. When you go through their history and talk to them, they might have had 3 or 4 children delivered vaginally, and that can put some strain on the pelvic floor and contribute towards the prolapse, which then leads to loss of bladder control. So very quickly, just talk about pelvic floor exercises. Like I said, we talked about it at length in the episiotomy video, and it's simply the process of strengthening your pelvic floor muscles. So to do them, imagine you're trying to stop the flow of urine or trying to hold yourself from farting or passing gas. When you do this, the muscles that you're tightening are the pelvic floor muscles. Now, while you're doing these exercises, nobody should know that you're doing them. So you shouldn't move your legs or your buttocks or your tummy. You should be in a sort of natural position, but you're doing this squeezing inside. And like I said, imagine you're trying to stop urine. If you're trying to do this to strengthen your muscles while you're pregnant or after pregnancy, you should do them every day. It's recommended that you do them every day, 5 sets of pelvic floor exercises. So you can be sitting comfortably in your chair, and every time you contract the muscle, hold it for a slow count of 10 and then gently relax. Do that about 15 times, and that's 1 set. So 15 times, and each time you do it, slow count of 10, then relax, that's 1 set. And you can do that 5 times during the day as recommended. So that can help to keep your pelvic floor muscles strong. I think the most important thing to emphasize for ladies is not to bear this. It's like I said, you can have urinary changes when you're pregnant, but things should go back to normal after a few weeks. If it goes beyond 6 weeks or you start to experience this problem, we do have treatments. So it's not something that you have to bear and endure the discomfort or the embarrassment that can come with urinary incontinence problems or prolapse. So please speak to your healthcare provider. It's really important to get things checked out quickly and get treatment in place, get treatment started quickly. So thank you so much. That's all I wanted to touch on for today's live stream. Please make sure you share the video. Thank you for joining me, for being with me. If you found it useful, make sure you like the video and consider subscribing to the channel. Thank you so much for everyone who's been here. Let me know if you've got any questions. Obviously, you can watch the replay, put any questions. And if you have any suggestions, any topics that you'd like us to cover, whether it's pregnancy related or whether it's something to do with something else, that's perfectly fine. Put it in the comments section. I'll have a look and see if we can put something together for you. So I hope the rest of your Sunday goes well. I hope you have a fabulous week. I appreciate you joining me. Oh, we have a special for next week. I have a really great guest coming in to talk about postnatal depression. You'd love her. I'm not going to spill the beans yet, but just make sure you look out for the link. It's going to be posted pretty soon. But we're going to have a really good discussion talking about issues around postnatal depression and current treatments, the problems that surround the diagnosis. So that's a teaser for you. I'm looking forward to that, and I hope you will join us as well. Okay, thank you again for joining me. I hope you all have a great week, and I will see you soon. Stay well.